bilingual school.
We're on.
She's fluent in Spanish.
Good evening. Welcome to the July 8th, 2024 meeting of the Cumberland County Board of Commissioners with all members present. We like to start the meeting with the Pledge of Allegiance, and please feel free to join us, anyone who wishes to do so. I pledge allegiance
To the flag
of the United States of America
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you. First order of business is approval of the minutes from the June 7th, and there was also a June 10th proceeding.
Second.
Moved and seconded. Any discussion? Seeing none, all those in favor say aye.
Aye.
Opposed? It's unanimous. We are pleased tonight that we have an opportunity for a report on the Lakes Region Homeless Needs Study. And I will ask Mr. Gailey to introduce whoever is going to be making the presentation.
Fantastic. Thank you. As the commissioners are aware, for the last number of months, we have undergone a review of what the homeless situation up in the Lakes region has been. Tonight, we're getting our first glance through a report out to the commissioners on what the findings are of a pretty extensive outreach in that region, and also looking at different aspects of homeless and homeless services that could be provided. So I'd like to invite Jeff up. Jeff, you gonna take the lead, or?
Sure.
All right. And bring us through this process and the findings that they have found within the report.
But is this,
Okay, you're all good.
okay, so this is working. Thanks. Hi, everybody. It's nice to be here tonight. My name is Jeff Levine. I am a consultant with Levine Planning Strategies, and I'm a professor at MIT's Urban Studies and Planning program. Previously, I was the planning director in Portland for 7 years, and I'm still in the region, still love this region, so it was really great when I had the opportunity to work on this project. This is an interesting project because it's a little different than most of the types of stuff that we'll do. And I'm really pleased that we were able to put together a good team to work on this. HSRI, Terry and Ben, sorry, disoriented, are here tonight from HSRI. They've done a lot of the outreach, a lot of the analysis of needs assessments, and they'll talk about that. I've also worked with a firm called North Star Planning out of New Gloucester that's helping me with a lot of the mapping and a lot of the siting work that will come up sort of in the next phase of the process, and they worked with me on the profiles of the communities. So just to sort of summarize, about a year ago, we started this project. Everything takes longer than you'd like because we want to make sure we get good data. We give people a chance to reach to us. We've set up several meetings, and but we're near the sort of finish line now. So it seemed like a good time to give you an update and let you know what the next steps would be. The overall purpose is to evaluate the needs and options for provisions of programs and services for people experiencing at or imminent risk of homelessness in the Lakes region. And so you see in your packet a 6 or 7 task outline, but really to summarize, the first step was to do a profile of the Lakes community, and I'll go through the 9 communities that we're focusing on. Wasn't necessarily to exclude, but you kind of have to draw the line somewhere. Then doing stakeholder interviews and focus groups, which HSRI really took the lead on with some of your help, and thanks for that. Then the next step will be, once we've sort of figured out what needs are out there and what possible solutions there are, sort of physically where those things might be located. So looking at opportunities for placement, what makes sense based on the needs that have been identified, and what land's available, because you can't put something where there isn't land available. So available is a little bit of a subjective term. Obviously, public land is one thing, private land is another thing. Talking to what's on the market may depend. So it's a little bit of a subjective term, but we're doing our best to figure out, what might be available, but we're trying not to get too far ahead of sort of the needs assessment and getting some feedback from you tonight. So these are the communities we focused on: Baldwin, Bridgeton, Casco, Gray, Naples, Raymond, Sebago, Standish, and Wyndham. And it was a little tricky to figure out where to stop. I know that we went back and forth with the county community development staff on this, and this is sort of what we ended up with. Again, not to be exclusionary, but to try to sort of draw the line somewhere. The first step we did was to understand the housing markets in these communities, because obviously people experiencing homelessness are often doing so because of the housing market. And I don't need to tell you that the housing market's tough everywhere in Maine, but certainly anywhere in Cumberland County is some of the toughest communities in terms of affordability. So we wanted to provide some quantitative data to back that up, not just say, oh, it's really expensive to live here, but say how expensive and what does that mean for people who are either experiencing homelessness or who may experience it in the near future. So we crunched a fair amount of data. This is the first sort of item in just looking at these 9 communities, and one of the things that we noticed right away was the variation between communities in terms of median household income, which you can see on the blue. There are some communities that have a higher median household income than others. And then looking at how many individuals in those communities are below the poverty level. So the blue bars line up with the left in terms of median income, and then the red line graph marches up to the right, which shows what percentage of individuals have been below poverty level in the last 12 months. So you have communities like Casco and Naples, where there's a lower median income. Interestingly, that doesn't always correspond to people experiencing poverty. So it's helpful to break that out and get a sense of different communities and where there's a little more median household income, where there's less. But again, with the understanding that in every community there are people experiencing poverty, none of these rates were below 5%, and some of them were above 10%. Then looking at the percentage of households in the community that are unable to afford the median home. And what do we mean by median home? We mean for the sales that have occurred recently, looking at the median sale price, figuring out based on what you might need to qualify for a mortgage, how much you could pay, and what you'd need to earn, and then looking at how many households are below that level. And this is a pretty stark chart, as it will be anywhere in southern Maine. You see that in all of the communities in this region, over 60% of the households are unable to afford that median home. That doesn't mean they can't find a place to live. That just means if they go out and look at the typical home in the market, they're not going to be able to afford it. And that sort of suggests there's going to be a struggle. They may find a place to live, but it's not just walking into town and finding a place to live like maybe it was at one point. So some of those communities are a little better off in that respect. Raymond, I think the median prices are a little bit lower. Some of them are up closer to 75% or 80%. Bridgeton's pretty high, which is interesting because in some other indicators, it has some more resilient characteristics. So this is why we go through this process to try to understand each of the communities. Looking at median household prices, and this is a little bit hard to follow with all the colors, but not surprisingly, since 2012, the median household prices have basically doubled in some communities. Other ones haven't gone up quite as much, but have still gone up a good sort of 50, 60%. Again, not news intuitively, but it's good to have that data and get a sense of really what we're facing. And I think this is part of why we're seeing more people experiencing homelessness or near homelessness now than maybe 10 or 15 years ago. Moving on to rental, looking at the median gross rent. So this is just a baseline. What would you expect to pay for a typical apartment in these communities? Again, some communities are more expensive than others. There's probably some market short-term rentals and seasonal homes that are driving these rents. So if someone's going to take a unit off the seasonal or short-term rental market, they'll want more monthly rent for it. But really, most of these communities are still above what many households can afford. Some are better than others, and this is one of those places. Bridgeton had some indicators that were troubling, and then in this case, actually, they have one of the lower median gross rents. So again, try not to read too much into individual characteristics, but to give you sort of a full sense of each community. This one I'm going to take a second to explain because it looks really intimidating. It's actually a really useful chart, so I'll take a second to walk through it. You start off with that gross rent, which is of all the rentals that we know about in that community, what's the median rent? So what would the typical apartment rent for? And what percentage is that of the average household income, not of all residents, but of those who rent? So we're looking just at rental units, and we're looking at people who rent. And if you look at that median gross rent that's online right now, what is that as a percentage of those household incomes? Oftentimes, we try to keep that below 30% of that household income. That's a general measure of affordability. There's no magic number there, but that's something that's sort of emerged probably partially because of mortgages and how mortgages generally start with that as the number that you can afford, but generally seen as a rough measure of affordability. So if a household is spending more than 30% of their income on rent and on other housing expenses, it doesn't mean they become homeless, but they're more at danger of becoming homeless because they're spending more of their income than they should on housing. So the light colored at the bottom, those are the households that are either didn't have data for, which is a pretty small number, or less than 30%. So those are the renters that are not housing burdened. So in Baldwin, it's nice to see 81%. It's a little troubling when you look at places like Standish, where it's much lower, or Naples. And then when you look up top, that's where you have the other story. The dark red is where people are spending more than half of their household income on rent. That's really a troubling number. And you see for some of these communities, it's 30% or more. And then that middle category is you're paying more than you should, but you're probably still kind of able to stay housed, but you're maybe one bad event away from really having trouble. If one person loses their job or if your car breaks down, suddenly that amount that you can afford now becomes much harder to afford. So some troubling indicators in some communities and just in general, really suggesting that a lot of people in this region are housing challenged. Again, not a big surprise, but it's important to put data to that. Oops, did I go backwards? I did. So just generally looking at home ownership and rental households, who's spending more than 50% of their income on housing costs. The blue is home ownership, people who live in homes they own. And the red is renters. And I think the big takeaway from here is that we sort of explained in the last slide about renters. It seems to be even worse for people who own homes that are spending an awful lot of more of them are spending more than 50% of their income on housing costs. So just because you own a home doesn't mean you're out of sort of the woods. You may have a variable rate mortgage. You may just have a very high mortgage cost. It's hard to say exactly why, but it does show that this is not just a renter challenge. This is something that people who own homes may be at risk of as well. They may be at risk of losing their homes and be experiencing homelessness. I mentioned before about 30% is a good number. 50% is where you get sort of extremely cost burdened. This is the percentage of households overall that would be considered extremely cost burdened. Again, you see Casco and Naples sort of jumping out as the highest ones, Sebago a little behind. But any place where there's 10% of folks extremely cost burdened means there's probably going to be some people experiencing homelessness or at danger of that in the near future. The other piece that we looked at in this section is the zoning generally to get a sense of how hard it might be to produce more housing to try to bring down some of these housing costs. So we analyzed what sorts of limits might exist in existing zoning to multifamily housing. And this is not designed to suggest that multifamily housing should be allowed everywhere or allowed nowhere. It's simply a chance to sort of analyze what's the current zoning and land use codes doing in terms of driving the housing market. And if you try to do just a simple is it allowed or not, you might get an interesting chart, but it doesn't tell the full story. And I can say this as someone who worked in planning for a long time. There may be a lot of other ways it's very hard to produce multifamily housing. It may be that there's heights that are very low. It may be that there's a process that's risky, and so developers don't necessarily want to go through it. So you see the light sand color where it's simply not permitted. But then you have a lot of areas where multifamily housing may be permitted, but it may have some of these restrictions on it. So as you get to the darker red and brown, it gets harder and harder. I mean, it's the opposite, I'm sorry. As you get to the lighter colors, it becomes harder and harder to produce multifamily housing. And you see some patterns here. You see communities like Naples, which actually seem to generally be more permissive in terms of multifamily housing. You see Wyndham, which has done a lot of planning along the 302 corridor to allow multifamily housing in certain places. And even in those other areas of town, not as restrictive as some of the other communities, Sebago, Baldwin, Standish, Raymond, Gray. Now these are places that allow single-family housing, and they may allow single-family housing on small lots. But this is just one way of analyzing generally how do the regulations affect the market and how hard it might be to produce more housing to address some of these affordability problems. Finally, in this phase, and then I'll hand it off to these folks to go through their portion of the study to date, we looked at the comprehensive plans. So that's one thing to show what the zoning shows today. As planners, we look at what are the comprehensive plans in the community and what sorts of things do they think about when it comes to housing goals. So do they address sort of providing more elderly or senior housing? And you can see of the 7 communities that had relatively current comprehensive plans, 4 of them did. Naples is the only one that really talked about below market affordable housing for low income residents. Bridgeton talked about first time home buyers, talking about mixed use, a couple of communities, and then talking about the regional housing issues, a couple of communities. So this helps give us a sense of where communities identified housing issues in their comprehensive plans. I think the bright part of this chart to me as a planner is that all of them but one really talked about updating their land use codes. So while you look in the previous sort of map about how hard it might be to do multifamily housing in a lot of these communities, at least these 6 recognize that challenge, and that's promising. On the other hand, producing more housing takes time, and it's dependent on more than just regulations. As we all know, interest rates are very high, construction costs are very high right now, so zoning is not the only barrier to producing more housing. And then you have to make sure that you can provide adequate septic if it's not on a sewer system. So there's more to it than ordinances, but I like to say that ordinance updates is sort of almost the free way to produce more housing because it doesn't necessarily cost anything. These other things start to cost money. With that, I'm going to hand it off to the folks from HSRI on the needs assessment. So Terry will take it from here, and then we'll be around for questions. Thanks.
Thank you.
Yeah. Hi, my name is Terry Camacho Gonzalez, and I work for Human Services Research Institute. Ben and myself, we're located in Massachusetts, but we are a small but mighty nonprofit. We have over 75 staff in 26 states, including Maine. So small but big, and we are part of the behavioral health team. So we work on mental health, substance use disorder, projects, research, evaluation, policy, and then we also work on the area of housing and homelessness, looking at programs and services for the unhoused. We have worked on national projects for the Substance Abuse and Mental Health Services Administration on homelessness and housing, as well as state and county. And we were lucky enough to work in Maine a few years ago on a Maine housing homeless needs assessment. And Jeff called us out. So actually, a lot of the data that Jeff presented, we heard about. People talk about a lot of that issue that he presented. So I'm just gonna go through what we did in our data sources, participants, our methodology, what our findings were, and then Ben will walk us through the recommendations. So we conducted 26 key informant interviews during the project. We started off with a list that was provided by Cumberland County, and we built on that list. Every time we spoke to someone, we said, is there someone else that we should talk to in the community? So that list grew. We had over 40-something individuals. Some people could not speak to us at that time. So we did have some people that we were not able to interview, but we did end up interviewing 26. We did 3 community listening sessions, and the Commissioner, Susan, attended all. Did you attend all 3? I think you did. We had a total of 29 participants, not including staff from Cumberland County and other interested staff. So we ended up doing focus groups one day, and people that that hosted us also attended the community listening session. And then most important, what we find is the most important is to directly speak to people who are unhoused and facing homelessness. So we did 2 focus groups with people who actually had lived experience of being unhoused. Some were at that time unhoused or had recently been unhoused. And we had a total of 17 participants that participated in that, and I'll tell you a little more about that. A lot of stuff here, sorry. So the key informants, as I said, we started them in August and completed it in December. This work takes time, a lot of reaching out to people. We used a key informant interview guide that the county reviewed. The interviews were about 60 minutes, and they were recorded with people's consent. The way we did is typically Ben and I sat through every single one of those calls, and then we had a note taker who would take notes. And if the note taker wasn't available, then one of us would go back and do the notes. So we had identified 47. We reached 37 of them, 79%, and ended up interviewing 26, so a 70% reach. And like I said, the county identified some key informants. Here's the list. I'm not going to go through it of the organizations or stakeholders that were represented. So housing organizations, general assistant, the homeless service hub 2. It's a whole list. Housing, prep. We also talked to people in Portland, like from Preble Street. I'm not going to go into it. Community listening sessions. So we conducted 3. One was in Bridgeton at the Bridgeton Community Center. Another one was at Naples, the American Legion, and one at Wyndham, the Wyndham Public Library. And those were conducted in January and February. We also had a guide, which was reviewed by the county. Flyers were posted for each session at the facility. The county also posted them in newspapers and in their website. So it was publicized. And the sessions were about 90 minutes, and again, they were recorded with people's consent. And for both the community listening, and then this is some information about the community listening sessions, we had a little demographic survey because we want to have a sense of who was there. Participating in the sessions were staff from community organizations, individuals who were or had previously been unhoused, family members of people that were or had been unhoused, and community members. In Bridgeton, there was 9 participants, Naples 5, and Wyndham was the biggest with 15. That was our first session. And then in the little demographic survey, we asked people where did they reside, what town. So 24% were from Bridgeton, and then you see the other breakouts, 14, 4 each were from Casco, Naples, Wyndham, Gray. So there was representation from most of the 9 towns. There was a few where we didn't have representation, and then there were people from outside the Lakes region. Focus groups were also conducted in person. We did 2. The one in Bridgeton, we did it in partnership with the Lakes Region Recovery Center. So the way it was, when we were doing the key informant interviews, we would get a sense of where we felt that we could connect with people that were unhoused, because that was very important to us. So when we talked to the director at the Lakes Region Recovery Center, she was very open to us having a focus groups there. And then we also interviewed the woman from the Crosswalk Community Outreach, and she was also very helpful in having us do one at the Naples Town Hall. We wanted to make sure people would show up and that we could have good representation. We had a guide again. We created flyers. Again, it was like 90 minutes, and they were recorded with consent. The people that participated in the focus groups were either currently unhoused or recently have been unhoused. We had 10 in Bridgeton and 7 in Naples. And we also did the demographic survey. So you can see the age varied. We had people from 25 up to 65 and older. We did have 2 individuals that were in that older range. And of the town where they were currently residing, so we told people, where are you spending the most time, or where is your car located, or your trailer, or your tent? And 35% were in Naples, 24% were in Bridgeton, and then there was one person who was going back and forth. One person was in Casco, and 6 said they were in other locations, Norway, Harrison, and Denmark. We did compensate the participants $30 in cash. And we also provided a light snack, and it's what we typically do. So qualitative data analysis. We did a very systematic analysis of all the data that was collected from the interviews, the listening sessions, and focus group summaries. This is why it took a little longer. We used a software in Vivo. Could talk more about it. And it's doing deductive and inductive analysis, and we use a coding structure. And then line by line coding. And so analysis this is about high rents, so coding line by line all the notes that we had. And then, so out of that analysis came out the key themes that were consistent across interviews, listening sessions, and focus groups, regardless of who told us what. So, someone who was in an organization did not have we did not consider there's more important than a person who's unhoused. So the key themes are summarized in the report and in this presentation. There's some things that might not be in the presentation because we don't want to keep you here forever, but it's all in the report. So let's talk about findings, and I'm going to try, and am I going too fast? I have a tendency of talking really fast. Not a lot of caffeine today. So we're going to talk about homelessness in the Lakes region first, the extent of homelessness, second, populations that are facing homelessness, and then factors that are contributing to homelessness. A lot of the issues that Jeff talked about, you'll see, came out in the data that we collected. So the extent of homelessness, we asked people what is the extent of homelessness in your town? So whatever town they were familiar with in the Lakes region, and the estimates range. You know, some people were higher, about saying around 30. Some people say 10, 12. We did get the higher estimates from the McKinley-Vento liaisons, the staff that is in the school systems working with children and families that are unhoused or at risk of being unhoused. We did not have access to the annual point-in-time counts for the towns within the Lakes region. We would have loved to have that data. We did not have that data. Only a few informants did not see homelessness as a huge problem. Some were saying, oh yeah, there's some, but it's not a huge problem. While others noted that it was a big problem and it was increasing. It was getting worse. Informants noted that there were many people that while they may not be unhoused at that time, were at imminent risk of becoming homeless, talking about within 30 days. And Jeff talked a little bit about this. People could be one check or one emergency away from being unhoused. And the people that we talked to, you know, there was reasons why, factors contributing to homelessness, which I'll talk about in a little while. One of the big challenge about the Lakes region in Maine in general is the challenge of the hidden homelessness in rural areas. It might not be as easy to say. I mean, you could see it in Portland, you can see it in some areas, but people might not see that there are people that are unhoused or not recognize it. So it is different. It's definitely harder to put a number on it or say, yes, it's a problem. Though some people definitely saw there was a problem. And we do want to work with the Maine Department of Health and Human Services to develop better estimates, if possible, of homelessness in the region. That is definitely an area that needs to be improved. A lot of boxes here. So this is just identifying some of the populations facing homelessness in the Lakes region. We have single adults as well as families, both single and two-parent families, young adults, older adults, children and youth enroll in the public schools and their families, unaccompanied youth, definitely the McKinley-Vento have C unaccompanied youth. We have people that have or are in recovery of a substance use disorder or have a mental health disorder or illness. There are people with co-occurring disorders, whether it's mental health and substance use or other comorbid disorders, people with health issues, and we did see that during the focus group. We heard about people with intellectual and developmental disabilities, migrant workers, veterans, and people who have experienced domestic abuse or intimate partner violence. So there are many different types of population facing homelessness in the Lakes region. And this is, you know, it's not just the Lakes region, it's in Maine, it's throughout the United States. A little more about the populations facing homelessness. We did hear the single adults typically tend to live in the woods or in tents, while families tend to more likely live in cars, campers, and trailers without electricity, running water, or staying with families or friends, or what is referred to as couch surfing. Despite there being more people moving into Maine during the COVID-19 pandemic, and we heard about that a lot, they are mostly people that originally come from the Lakes region or who have lived in the Lakes region for a long period of time. We did hear, and the commissioner could attest to that, people saying they don't want to leave the area, They want to stay where they are from, where their families and friends live, and especially if they have children in the area. They don't want to relocate out of the Lakes region. And people that are not originally from the Lakes region or the state end up in the Lakes region because of the easy access to Route 302, and because Maine is perceived or seen as having rich resources for those that are unhoused. This is what stakeholders told us. What are some of the factors contributing to homelessness? And some of this we saw in Jeff's presentation. There's definitely low wages, inconsistent work or unemployment. We heard about many people living on fixed income, Social Security, disability. It doesn't keep up with the high cost of living, which is the next box that you see all the way on the top on the right. We all know this. There has been an increased food costs. If you go to the supermarket, what used to cost you $100 might cost you now $150, $200. The availability and cost of childcare is huge and really impacts people and contributes to homelessness. And the lack of transportation, this is very important. We did hear about people not having cars, not having transportation that can get them to jobs. The jobs that they need in order to be able to, pay their rent and have the money. So transportation is important, and we do know there's the regional transportation and only travels certain times of the day, during the week, and certain stops. So there are limits to the availability of transportation. And then factors that, we did see some of the populations that are unhoused is that they're suffering from mental health and substance use issues. They have disabilities or domestic violence or intimate partner violence victims. And then there's COVID-related factors. We heard a lot about this. People discussed the influx of people coming into the region has impacted the housing stock, the cost of food and other necessities, and also very important that the end of the pandemic aid really has impacted people because the pandemic aid, that's the EBT and the funds that were available, really supported housing stability for people, and those have come to an end. So that has really contributed to people being unhoused. And these are some housing-related challenges that contribute to homelessness. Transportation, of course, is challenging. If you don't have a car, you can get to look at apartments, look at housing, and get to housing back and forth. We heard a lot about the lack of affordable housing, and Jeff talked a little bit about that, and the limited housing stock. We were shocked by some of the rents that we heard. People said rents in the area can range from $900 to $2,600. That is more than my mortgage in the Boston area. And there's also, there was a lot of talk too about the increase in property values, which people saw as being impacted by more people moving into the area during the COVID-19 pandemic. Jeff talked a little bit about this. There has also been an increase in investment properties. People are turning their houses into Airbnbs or seasonal or short-term rentals, so there's less housing available for people to rent at a reasonable price. The lack of multifamily housing, we saw that map, how that is definitely an issue. Many people talked about, especially people who are unhoused in the focus groups, not having credit or the funds needed to obtain housing. Some of the amounts that people told us that they needed just to be able to get an apartment was really high, and we talked a little bit about it in the report. And then they have to apply, they have to pay a fee to apply for apartments, and they don't get that money back. So the more apartments or housing they apply for, the more fees, and then they have to have deposits first month, last month, and the security. And one thing that we did hear about is even people that have housing vouchers available, they find that it's very difficult to get them, for landlords to accept them. There's a lot of misconception out there about housing vouchers. There's a lot of stigma about some of the vouchers that are available and what people see about them, and we get more into it in the report. Another big issue is animals. A lot of the people that we talked to that were unhoused had animals with them, and noted about animals not being accepted in housing, even when those animals are support animals in help with health issues. And this was big, and also people talked about animals not being accepted in some of the shelters outside that exist. In the Lakes region, there's very limited availability of hotels and motels. They've been, I guess some had more and they've been turned over. So that's definitely an issue. So even for, if they have vouchers for hotels or motels, it's very difficult to find a spot. And then there's many barriers to staying house. People have lost the housing they've been in because the house goes into probate, someone dies, and they need to move out. Houses get foreclosed, condemned, people get evicted or asked to leave the housing in very short notices. And then there's, we did hear about poor quality housing that is available that is just not livable. In our report, we did, because we talked to many people, we've identified that there are many resources in their areas and services, and I'm not going to get into them. We go into them in the report, but this is just highlighting some of the housing and homeless resources and services that are available. Again, some more. I just want to talk about local landlords. When we started this project, we really wanted to speak to landlords, and we spoke to key informants and was like, can you tell us of any big landlords that are out there? And people couldn't really identify, but then we did connect with some local landlords that actually rent rooms in Bridgeton, Casco, and Naples. And that was a good find for us to be able to identify some local landlords. Now I'm going to talk a little bit about the resources and service barriers, gaps, and needs. Of course, at the top we have transportation. It's a big barrier. There are few alternatives to car ownership, and high cost of maintaining vehicles are challenges. People that utilize the public regional bus system, it doesn't go anywhere at a certain time. It's only a certain time, and we did hear about people trying to use like Uber or Lyft, and just going from town to town, it's very expensive. So it's not a consistent, reliable way of people to move from one town to the other if they have a job. Let's say they live in Bridgeton and have to go to Wyndham for a job, or Naples. Some of the other barriers and gaps needs identified. One is that the Lakes region is part of Cumberland County and is lumped with the more urban Portland area. And there are many differences between the Lakes region and Portland that's more urban. Finding people who are unhoused, counting them, and then the availability of housing and services. And the second one talks about counting people who are unsheltered during the annual PIT count. It's more difficult. As many of you know, the point in time count is done specific day in January, very cold month, and you have to go out there and find people. And especially when people are hiding, it's very difficult to identify people that are out in the woods or staying with people and count them. There's the third bullet altogether. The lack of an emergency shelter and transitional housing in the Lakes region was identified as a big barrier or gap. We heard a lot about the need for emergency shelter and transitional housing that would help people move into more permanent housing. It was noted by some stakeholders that there is insufficient rapid rehousing services to get people into permanent supported housing, or permanent housing, which is the goal, to get people there. There's also lack of supports, for example, navigation services to keep people from becoming unhoused, and once they are unhoused, supporting them. So helping them find an apartment, helping them find those landlords that are gonna accept those vouchers, helping connect them to services. There are limited resources to refer people for services and support. We did hear also about long waiting lists for services, not just mental health, substance use, but also just going to a primary doctor. It's very long waiting lists. more resources and service and various gaps and needs. And sorry, the boxes are small, but we discussed them more in detail. Definitely, we heard a lot. We focused on a lot of what services were needed. And we heard from people, there's more need for case management, the resource navigation, helping people get into housing, child care, we heard about how expensive, parenting classes, assisting people, domestic violence services, vocational or educational counseling, financial literacy, fuel or heat assistance, and we do know that some of it is available through general assistant, legal assistance, mental health, SUD, dental, and medical services. One thing that was a barrier that was identified is this, if you do not have a mailing address, it's very difficult to obtain main care, to take care of your health. And just to have a mailing address is actually very important just to get benefits, to get connected to services. So that was identified. Many people have no phone or inconsistent cell reception, which it is in the Lakes region, but that also is a barrier to connecting to services and resources. We heard a lot about general assistance and some of the barriers related to that. Some people felt there was limited awareness of the program and what was available. We also heard about how sometimes it is difficult to access the program depending of where it's situated in the town. Sometimes, it's one place and someone might not be available there at all time, that there are caps on payments. There's no supports available like case management or housing navigation to help people connect to housing. In order for you to get a housing payment, you have to verify you have a housing. So if you are trying to get housing, that might be very difficult to get a housing payment. Though funds can be used for hotels and motels are not available, as available in many of these towns. And then we do know the emergency funds can be used for one-time rent payment or to help pay for heat. But those funds, it was noted to us, don't help someone that is already unhoused. They cannot get those emergency funds. And then we did hear, because we did speak to the McKinley-Vento liaisons and people familiar with the program, there were a lot of barriers related to school resources in the McKinney-Vento program. Again, the lack of awareness about the program. It is difficult to identify sometimes students and families that are eligible for the program. This is about the hidden aspect of homelessness in the region, and just people are proud and not wanting to tell others that they are unhoused. There's definitely more education needed for staff to help identify children and families that could be eligible for the program. And we did hear a lot that most of the resources available for the McKinley-Vento program are going towards transporting students to the districts where they're going to school. So because housing is expensive and not available, so families might move out of Bridgeton and go to Wyndham, but the kids stay in the Bridgeton school system, so the school system has to bring them from Wyndham to Bridgeton. So a lot of the money goes into bringing the kids back to their districts. And we did hear about a district, we did talk to a district where they would actually get the kids to school, but there was no transportation back home at the end of the day. So parents had to scramble. Yes, we did hear that, I know. It's like, get them to school, but we can't get them out. And now Ben's gonna come up and talk about our recommendations.
Hi, everybody. I'm Dr. Ben Saki. I'm a researcher on the behavioral health team at HSRI with Terry. And as Terry had mentioned, we've worked together a long time, 18 years, a lot of different homeless focused projects. So I'm going to go over our recommendations. Basically, our recommendations are really rooted in what we heard from our analysis, what we heard from the people, from the stakeholders. And that really drove and informed, what we chose to focus on, as well as some of the nuances of what they were saying, informed sort of why we recommended some certain elements with it, and we'll get into that a little bit more. So the overwhelming recommendation, or that we heard, or the real screaming need from nearly every key stakeholder that we talked to, really felt that there was a need for a one-stop service center somewhere in the Lakes region. So we heard a lot about, people aren't willing to necessarily travel to Portland. They want to stay local, as Terry was saying earlier, with their families, next to their, by their children. They don't like the urban nature of Portland. A lot of the problems, alcohol, drugs at the shelters and stuff like that. So that's also, really one of the factors that makes estimating numbers hard, even in the Lakes region. Even if you're looking at something like HMIS data, those are people that have found their way to a shelter somewhere else outside of the Lakes region. So we know that's only a small subset of people that are actually experiencing homelessness that actually make it as far as Portland or into Lewiston or into Rumford or somewhere else where there's another shelter. So, we heard that there was a need for the one-stop service center, and one of the things that we did hear from folks was that there was a real need for some shelter beds available at that center as well. So not talking, necessarily anything like the size of the HSC in Portland or anything like that, but people did emphasize, that there needed to be places to stay, needed to be places you could get out of the woods, in the winter where you could be safe, be warm, but there was a definite need for that. The key informants are based on kind of the totality. The recommendation is that the center be located in either Bridgeton or Wyndham. And there were a number of factors that were informing that selection of location. Some of the major ones were the proximity to Route 302 and the Lake Regional Explorer bus route. So, even though that isn't perfect and does have some limits on availability, it is a public transportation that is available and useful for people. A real key factor that was emphasized in the locations were the existing service infrastructures already in place in both Bridgeton and Wyndham. So in the kind of the Bridgeton Hospital area, there's already a number of different service providers and programs sort of in that area, and they're fairly centrally located for people. The location is somewhat central within the Lakes region, definitely more so for Bridgeton rather than Wyndham, but because of the proximity to the 302 corridor, most people thought that would be, they would be able to get to either Bridgeton or Wyndham, even if they were in Casco or Sebago or somewhere else to get to those services. And then we also focused on towns that were a little bit larger in the area. A lot of people emphasized the need for just businesses, supports, and other economic activity, that would give opportunities for people to earn income and help find housing as well. So Bridgeton and Wyndham were selected because of that. So the one-stop service center, we are recommending that the service center follow a service hub model. And what we mean by that with the service hub model is just basically that the service providers are available on site, or actually have physical space located within the center to be able to provide services. And also, or at the very least have very strong connections between the service center, so maybe if a dentist or something like that maybe isn't physically located at the service center, that there are memorandums of understanding, that there are agreements in place so that people coming in and accessing the service center services are able to quickly access those other services as well. So the kind of most needed services that we heard and what we decided to recommend were, of course, some shelter beds, the amount open to discussion, but definitely that would be a call, or a desired element. Case management, resource navigation, and housing navigation. We tended to kind of use them interchangeably. They're all slightly different services, but really all serve the same purpose of helping connect people to other resources, other services. And especially with the housing navigation, Those are folks that are able to develop relationships with landlords and get, learn about apartments, learn about vacancies before they're publicly posted, available, and are able to sort of connect and really develop trusting relationships with landlords, get landlords to take chances on folks with apartments that they might not otherwise do. But those sorts of services, where it's not just handing somebody a phone number and saying follow up with this provider, but somebody that can actually help the individual make those connections and follow through with things is something that's really needed. Mental health and substance use disorder services or connections to them, no surprise there. Same thing with transportation. I at least was a little bit surprised at how many had mentioned like medical, dental, and eye health services. Just they are available in the community, but there are barriers for folks accessing them if they are in-house, and that was called for. That would be folks thought those would be very useful. Transitional housing, as Terry had mentioned. So not only sort of the emergency temporary shelter beds to provide immediate shelter, but it would be optimum if there were sort of additional housing units where people could maybe move into for a longer term stay, might be a few months or something like that. That's part of the sort of continuum of services in that way. That can help ensure that any shelter beds that there aren't being clogged by individuals then that can't find something else either. And then, ideally, they'd have a little bit more time able to locate more permanent housing in the community. But it's just a way of trying to buy people shelter and a little additional time to locate permanent housing. Financial literacy classes, that sort of thing, anything, education, how to better use your money. We did hear that a lot of the local banks in the area will actually provide the services or classes in the community for free. So that might be something, connections with the service center, you might be able to get the bank coming in and doing some of those services regularly. Connection to employment and vocational services as well. So in some areas, occasionally, like there'll be an actual VR intake day or something like that at a service center. So somebody can connect with the State Department of Vocational Rehabilitation and food pantry. And the financial literacy and employment services, mental health, substance use, and the medical as well. Those are all really key services because they're things that are real directly addressing some of the root causes of homelessness and some of the factors that are influencing homelessness that we heard. So there were, some design considerations for the service center. One of the big things that we heard that was really important, or that would be really attractive, I guess, at the center would be to have space available where pets could be accommodated. So as Terry mentioned, not only can having animals be a barrier when you're actually trying to get housing, or even if a landlord accepts animals or something, there might be additional costs for security deposits and other things that might impact. But we heard a lot of from folks directly experiencing homelessness. People are going through challenges, and oftentimes their pets are their rocks for them. They're their emotion, they're their one source of unconditional love when the rest of society is spitting on them. And the thought of giving up that animal in order to get out of the cold, even for a night or to stay warm, is just too much for people. So, that was one of the things that we really heard, like having a space. Obviously you can't have animals running wild through the center or something like that, but if there were kennels or boardings or some sort of area where they could be safely physically housed on the space, but people would still feel close to their animals, that seemed like that would be a major barrier and get some of those chronically homeless individuals that aren't willing to come off the streets. a lot of the sort of design features were really informed by what we heard had been working well. I mean, just sort of best practices for service center design, but also things that the Homeless Services Center in Portland had done. So just in terms of kind of the approach to the physical design of the building, you know, not having it be institutional, having it be warmer colors, you know, lots of natural light, you know, sort of airy feelings, things like that. Locked storage spaces, showers, beds set up in quads with charging stations available, you know, laundry facilities on site, kitchen and food prep areas on site. Those were all important elements, and again, all elements that have seemed to have been working well at the Homeless Services Center in Portland. So in terms of the service center management, we had a couple of sort of recommendations just kind of going through the process. One of the first ones is to convene a community advisory board for the center whenever a town is actually selected or being considered. You know, it's really important to get community buy-in on board and from the very early stages of the project. So, you know, the host community needs to sort of own the process some as well. One of the ways that you know, that can be done is through the Community Advisory Board. And again, that is an element that was implemented at the HSC here in Portland that has seemed to really go well from all of the stakeholders we've talked to. One of the things would be to create a formal political liaison position to sort of work with the host communities. You know, we envision this as sort of being it would be a full-time person or individual dedicated to getting the project, you know, sort of off the ground, and would be something that would be in place during the development of the center, and then, you know, the idea would be that maybe then the Community Advisory Board and the head of the Community Advisory Board and the center itself, management itself, would then, as the center is up and running, be able to take over some of those liaison functions in terms of regular meetings with the community, you know, addressing any concerns from folks in the community, that sort of thing. And then this is actually really, really key. It's almost, I think, as important as having shelter beds attached to the center, is that there really needs to be a dedicated mobile outreach services. So just with the geography of the Lakes region, you know, you've got giant lake right in the middle of it that makes it hard to get around everywhere. And looking at the towns, you know, that were within the study area, there is no location that works for everybody. You know, no matter where it is, it's going to be out of the way. It's going to be across the lake from Sebago if it's in Wyndham. You know, it's Bridgeton, you're tucked up north, you're away from the rest. So, you know, and because of the transportation issues that we frequently heard of as well, you know, it's, I think there's a fear sometimes that if you build it, they will come. But, you know, there'd be a lot of barriers for people coming to it no matter where it's built. So one of the elements that really needs to be part of it is mobile outreach. People associated with the center, could be the center staff, that are going out into each of the communities in the Lakes region, seeking out those folks, trying to make those relationships. Oftentimes it's outreach vans like, you know, delivering socks or snacks or, you know, drinks, bottled water, you know, whatever it might be, fire starters, you know, whatever it might be for folks. But they're able to go out there to begin developing some of those trusting relationships with folks and help convince folks then to come in out of the woods, you know, and address their barriers, their concerns, and try to get them into services, get them sheltered, and get them connected with needed services. So the other recommendation, and as Jeff was pointing out, there are a lot of challenges, I think, you know, with this. is to increase the availability of affordable and safe housing. And sort of our recommendation was for the county to consider, ways that they could promote creative solutions to developing affordable housing. So that could be, utilizing, developing, redeveloping unused properties in the towns, or something that's actually popping up in a couple of different areas. It's actually being done around the U.S., but we've focused on a couple of examples that were within Maine. Is this idea of using tiny home or small footprint affordable home developments as a source of housing for people. So Firefly Field in Rockland is a number of different organizations, like Habitat for Humanity is involved, the Homeless Coalition in the Rockland area is involved in it. But they're building 1-bedroom, 500 square foot residences, duplexes with 2-bedroom, 1,000 square foot, and 3-bedroom, 1,200 square foot residences. And then a limited number, I think there are only 4 or 5 single family homes that will be sold for people meeting the Habitat for Humanity's income guidelines. But that's an example of a relatively small development, taking advantage, small footprints, costs, lower costs of the smaller constructions, and I believe it's 14 or 16 permanent houses, homes that will be provided through that development. There's also the cabin in the woods at Togus. I don't know if you guys have been up there on the Togus campus. I was up there a couple of years ago, and it was pretty impressive. Seeing everything that they built, but I believe that's, I forget the number of them, 20, maybe around roughly 20 cabins, but they're doing 1-bedroom, 550 square foot cabins and 2-bedroom, 700 square foot cabins, and that are available for homeless veterans to move into. And then another sort of idea, this actually comes out of the I think they originated in the Eugene, Oregon area, but it's these things that they call Conestoga huts. So they're like the old prairie wagon, basically. That's what they're based on. They're small, I want to say 60 to 80 square foot shelters. They're made out of, they're insulated, canvas, wire. They resemble the wagon once they're built, but it gives people basically a place, lockable place, lockable shelter. They're out of the elements. They're insulated. So I don't know. Probably not good enough for a Maine winter, but maybe 3 seasons. Would probably be comfortable in this environment. But they're sort of a strategy. They cost roughly $2,000 to $3,000 per unit for all the materials, manpower, and stuff to build. So they're a relatively low-cost way of providing sort of a more transitional housing type of unit, and something that potentially at a one-stop service center, if they were being used for transitional housing during the 3 seasons, where that might be appropriate, just because of the nature of the the size, how you can fit them into the areas. They're very easy to scale up and scale down as needs change as well. Okay. So this is another recommendation, difficult sort of recommendation, and that's to really work to better identify the number of homeless individuals and families. As Terry had mentioned, we did attempt to get point-in-time counts for each of the 9 towns that were included in the study. We were unable to do that. It was unclear if it was impossible, as Maine Housing, how the data is stored, or if it was just something that wasn't readily available to us. But Like I was saying earlier, HMIS counts are good. There are people that are homeless, but they require somebody making it into a shelter and being connected with the system in order to be recorded. So, even if we were to have been able to get the counts town by town, that would still be a really underestimate of what the true scope of the problem is, because as we know from talking with folks, there are a lot of people that aren't willing to go to Lewiston, aren't willing to go to Portland, that stay in the area and aren't being connected and tracked there. And of course, then there's the point in time count, and like Terry had alluded to, the methodology with that, counting people outdoors in the middle of January in Maine. Of course, you aren't going to find very many people very easily. People are going to be hunkered down, hidden. So, one of the things that would really help identify or get to much better estimates, accurate estimates of what the true scope of homelessness is in the Lakes region would be the actual development of the service center itself. So, having that centrally located, serving folks from the area, especially with the mobile outreach team component as well. So you're still reaching out, making contacts with people that aren't waiting them, for them to come into the center or necessarily willing to come into the center themselves. But combining those numbers served from the center, combining the numbers of contacts from the mobile outreach teams would really give a much, probably the best estimate of what the true scope of homelessness is in the Lakes region, period. Even, the HMI, of course, the shelter might be a part of the HMIS system and stuff like that too, so it would, potentially help. But just being able to provide the service, see how many people are being served locally, will really help you better understand what the true scope of the problem is. As Terry had mentioned, sort of like in the findings, one of the things that we frequently heard from folks is that even when somebody does have a voucher for an apartment, that it's very, very hard to find somebody, landlord, that's willing to rent the vouchers to them. It's a lot of different reasons behind that. Some of it is just misunderstandings and myths. We heard from a lot of folks that landlords tend to think that if somebody's on a voucher, they can't be evicted, so that the landlord is basically giving up control of their apartment to the voucher holder. That's not true, of course. So, we thought one of the things that might really be helpful, there are limited units, obviously building more units and stuff like that of housing would help make housing more available, but also, making the units that are existing more available to the population that's trying to be served. Some sort of education campaign or, outreach campaign to local landlords that's emphasizing the benefits of the programs. Associated with the voucher programs, such as guaranteed payment each month, money being direct, that's the other thing sometimes they'll hear. Landlords will think that the money goes to the tenant, and then they've got to fight with the tenant to get the voucher money from the tenant, and that's not true. It goes directly to the landlords. But it, should really, really emphasize countering some of those common misperceptions and myths. And then something that's really powerful, as well, is to emphasize first-person accounts from people in the Lakes region about, how a landlord willing to take a chance on renting to me was the step that was needed to help me, propel forward, achieve my goals, get better health, whatever it might be. But, something that makes it that ultra-local impact, so it's people, not somebody in California, not somebody in Oregon talking about how this program has helped or this, these things, actually having it be ultra-local will be more effective. And then the other thing that, might be possible with the one-stop service center that's really serving all the towns in the area, especially if there's a housing navigator position, is that would be sort of a well-positioned person to kind of create information, track information about landlords in the area. You know, so a lot of, I believe in the report we focused on one from Miami-Dade County, like a website that they created where landlords that were interested in renting to folks with vouchers were able to sign up, and this, you know, Housing Navigator program manages this database. It's not a completely public database, so they are, you know, it's a way to kind of have units and keep track of units that might not be on the open market as well. And I'm frozen. Oh, is that the last one? Oh, that's the last one. So that's, yeah, so that's the last recommendation that we had. You know, just went through all of these, you know, very quickly. There's more details, you know, in the actual body of the report for the recommendations if anyone is interested. Thank you.
Thank you. Do we have any questions for these folks? My question is, what's next? For the two people that are watching us on TV tonight or later this month, knowing you know, some idea of the scope of the perceived problem, I understand the population that needs to be served is of uncertain size and composition, and we don't know what the budget for something approximating this kind of a program would look like at the moment. I assume all of that is yet to be worked on. But if you have any insights into any of that, we'd love to hear that.
Sure, thanks. And that is the last sort of primary task of this, is to look at potential sites and get some sort of order of magnitude budgeting. But that depends a little bit on what it is. So we'll have to, you know, we want to get this section wrapped up, and then we started looking at sites, but hopefully over the summer we'll be able to finalize, you know, potential locations. We won't necessarily have a recommendation for one, because I think that it really goes beyond what we can do, but we can identify sites that are out there that might work, give you a general sense of budget and what next steps might be if the county wants to pursue some of these recommendations.
Great.
I have one question.
Patty?
A great report, thank you for all the information and the analysis and actually the methods of how you came up with the data. It seems like the mobile outreach teams are a critical part in creating those trusting relationships and really getting your hands around, you know, what is the complexity of the problems and where are folks. Because of the rural nature of the area that we're talking about, it seems like having those mobile contact type units still kind of out there somehow, or keeping that going would allow the project to even have probably a higher success rate, because we're building those relationships, we're understanding that potential, and it feels like, I'm not sure where that might fit in next steps, but it seems like a real key element to right finding, right sizing what that next step is by having those contact points and keeping them alive.
Yep.
Am I misinterpreting?
No, I mean, that's exactly it. So it's, you know, developing those relations, you know, a lot of people sometimes, even when there are shelters, you know, won't go in the shelters for a variety of reasons, even if there is one locally. And yeah, the mobile outreach teams, you know, really, like I said, have the chance to start to develop those trusting relationships, you know, can directly address what are some of those fears, you know, about going into the shelter or connecting with these services, and help, you know, connect people. The other thing that's really great, you know, about them is they can really work to help meet people, you know, where they're at too.
Right.
And, you know, be working with them over some time. They can help directly address the transportation issue, you know, by providing actual transportation to the center, you know, or to a service appointment. But yeah, no, it's really that being there, you know, for somebody, having those frequent contacts, having that familiarity, and then, you know, helping out in little ways, really builds, you know, sort of best practices for mobile outreach teams, and that's really where they get their effectiveness in engaging folks that otherwise aren't willing to engage with the system.
We heard from people that, because of a lot of the towns, even for general assistance, they have to go into like the town hall. And we heard there was
Okay. Couple of fun facts to know and tell. In Maine, I've heard you talk a lot about vouchers and voucher resistance and voucher difficulty. In Maine, it is illegal for a landlord to discriminate against someone who is supported by public vouchers for rent. That's the good news. The bad news is there is something called a commercial endorsement to multifamily insurance policies that is in use in the United States. Maine does not regulate directly that kind of activity, and there is an endorsement that actually prohibits the subsidized housing tenants in insured properties and voids the insurance coverage for when they discover that circumstance in a claim. So hopefully someday somebody in Augusta will wake up to prohibiting that little practice. But in the meantime, those are a couple of factors that kind of bubble up to the surface from time to time. Any other questions? I'm sorry, can you come up to the mic when like I say, we have two people that watch us every 6 months.
Focus group participants and Commissioner, I don't know if you'll remember this, but he had a BRAP voucher, and he says the landlords don't know about it. So he does a lot of education himself, trying to teach them. But he says the first thing when you go to the website that it tells you is who's eligible for it, which is people who are have a substance use or a mental health disorder. And that right away, he says, it drives people away. They're like, oh no. So, just little things like that you don't even think about, but that's the first thing people are seeing. And that this person said, if people would just educate it more, landlords, about that. But that's a big barrier.
Okay, thank you. Anybody else? Okay, well, thank you all. We look forward to round two. That was certainly a comprehensive review of a lot of round one, and we appreciate it.
Thanks very much.
Thank you.
Thank you.
Nice meeting you all.
Yes, thank you.
We have 7 items on our consent agenda. First, is there any item that anyone would like?
Public.
Oh, we were going to do that, yeah, okay. All right, sorry. Comments from the public, 3 minutes apiece. Anyone who wishes to speak on any topic? Seeing none? Now we have seven items on the consent agenda. Is there any item that any commissioner wishes to have removed from the consent agenda? Seeing none?
Moves passage.
Move passage of all
Second.
7 items. And is there a second?
Second.
Been moved and seconded, and I don't see any reason to read these. We have the agenda in front. Please go ahead.
Reading these agreements, when was the last time these agreements were reviewed or renewed or whatever? Because I think we've got 2 or 3 versions floating around. Didn't we just have one with Harrison, and it's a different format than this has got?
Well, this is a topic that comes up about every time one of these matters comes before us. I do think one of the things that we thought we might work on this year was trying to move towards a more standardized, both agreement substance and charging basis. So that's, I don't know if anyone else has comments that they want to make related to that, and it certainly is worthwhile.
You gotta remember that Harpswell has a town budget that runs April 1st to March 31st, so maybe that's what's the difference. Majority of the people or towns do have a July 1 through June 30. So.
Thank you. Any other comments? Seeing none. All those in favor of the passage of the consent agenda say aye.
Aye.
Opposed? It's unanimous. And we don't know of any ARPA business, and our ARPA team is left, okay? No new business. So we ask for comments from the county manager.
Great, thank you. A couple quick items. First, want to welcome Erin Pelletier as our new Deputy Communications Director. I believe her first day was today in that seat. Erin has been a 12-year veteran for us in the communications room, moving up from dispatcher over those 12 years and supervisor into the deputy's position. So welcome aboard, Erin, and looking forward to working with her. Want to put on your radar that in August, we will have to meet. We have 2 time-sensitive bids coming in over the next 25 to 30 days. The first is the construction bid for the Northport building. And the second is a rather large HVAC project here in the courthouse. That not only is the stateside courthouse that we're in right now, but bleeds over into the older courthouse more for control purposes than anything else. So those bids are 2 bids that are out there today. We will have bids in, and they just can't wait until September's meeting. And so we'll work with the commissioners on scheduling that up. Lastly, talking about September meeting, I just want to put on everyone's radar that it's almost budget time again, and we need to hold a caucus for the Finance Committee. The 3 members of the Finance Committee that we've had over the last 3 years, they have all termed out. Many of them are interested in serving longer and probably will show up at the caucus in September. But I want to just put on your radar that the county staff will be sending out letters to town halls probably by the end of this month, inviting anyone interested in, when I say anyone, that's any elected official residing in any of the towns who want to participate to attend the caucus. And I believe it's September 6th, September 9th, somewhere in that area, that evening. And that would be before the regularly scheduled meeting. It's the September 9th. Thank you. So, as always, the commissioners will bring forth names from their districts, and then those names will be appointed at the regularly scheduled meeting starting at 5:30 that evening. So, and that concludes my communications. Thank you.
Thank you, Mr. Gailey. Our other public officials, starting with our deputy, Mr. Kimball.
Nothing to add at this time, thank you.
Well, thank you. Amy Jennings from HR.
Nothing at this time.
And Catherine Cahoon. Anything from the sheriff? And welcome.
Thank you. Just a brief update on staffing at the jail. Went in this morning and we changed our practice in that we've got 5 or 6 people hired. And instead of sending them to the July Academy, we're giving them training enough to they can work the floors. It seems to be working out well with the supervisors. We have a bunch of individuals that I hope to get an update tomorrow as far as them being in the medical part of the hiring. We also are expecting some polygraphs to come in. So we're thinking that people are going to start rolling in the next month or so. There's an academy in October, so we'll send a portion of those individuals. But we have a year once we hire them to send them to the academy and get them certified. We've tried not to do that because we want them fully certified and able to work by themselves. But it seems this gamble seems to be working and helping out through the summer. So this last weekend was probably our biggest hurdle because of the fact that it's the 4th of July is a very important day for a lot of people. We had a really long weekend. We went from 285 to like 324 today, and from what I understand, there were like 43 arraignments or something today, just on arrests that came in over the weekend. So we're trudging along, moving along good. Law enforcement-wise, we have a retirement coming up the end of August planned. And we just gained a new position for the Standish contract. So now Standish wants to hire an 8th deputy to do law enforcement over there. So they know that we won't be able to flip the switch and have a deputy arrive, but we'll start working on that and try to get that filled as soon as possible along with the other vacancies. So that's really where we are on the hiring. Any questions?
Just one question, Sheriff, what's the current vacancy number?
20 funded positions right now, but with three, it's down to 17.
Very good.
Big significance in the last year.
They're coming in, but it's, the last 3 or 4 years has just been plugging holes, so it's kind of like, we used to be able to kind of understand what vacancies were, but, you know, we worked on it today, because, you know, on one hand, we have a number that we put on our board that is the target, but it doesn't seem to change much. And so I credit the major today in trying to figure out what is that number. And that excludes the non-funded positions that, you know, we haven't funded currently, so.
So the
Commissioner Gordon,
the 17 remaining are still funded positions,
Yep.
right?
Yeah.
Okay.
And Commissioner Gordon, if you don't mind, I'm not sure your question was answered about the differences in contracts. I will say that Pat Dunn was the last person to go over the verbiage of the contracts. But every contract is slightly different. They, you know, some people want backfill for overtime, other people don't want to pay for it, you know, especially the SROs. So they're pretty much boilerplate, but at some point probably needs to go, you know, somebody needs to go over and just make sure that we're with the times. I would estimate that it was probably, we're probably working on it 10 years since it was really looked at. But again, we kind of tailor the contracts to the needs of the customer, if you will. And each town is different, how they approach it.
It just seems that, at least from this layman's point of view, you read it and it's the verbiage is not understandable. It's not congruent in my mind.
And I will say that, you know, even some of the substations, I mean, we've had substations for as long as I've been here, and up until maybe 2 or 3 years ago when it was brought to light in North Yarmouth, there was no agreement, written agreement, between the county, the sheriff's office, and the community. And I think right now, the only agreement we have is with New Gloucester, you know. So there are interested parties that probably need to come to the table and determine if this happens, what's going to occur type thing. But again, you know, we're kind of still in that age of, we've been in Naples forever, and it's always been given to us, and, you know, but I don't think there's any written documentation on that.
I do have another question, though. Are we going to get some federal prisoners in, and if we are, have you got any idea when?
Well, it was supposed to be today. You know, the feds were very interested in late May, early June. We were trying to get to a number of vacancies, and quite frankly, we thought we could start like the end of June, 1st of July. But I felt like that would be a slap in the face to the staff because people needing time off. So the plan was July 8th is the earliest we could do it. And to my knowledge, we haven't heard anything from the feds, right? Oh, okay. So it's changed since 5 o'clock this morning. So we're getting 10 tomorrow. And
That could change, but we're told by them.
And there was some, I don't know if you want to talk about ICE, your meeting with ICE.
So we had a meeting with ICE officials for the region, and they're interested about housing more than what they currently are right now. So you can take that with a grain of salt, but the two target areas that we discussed with them about the classifications wouldn't affect the staffing. So they're open to that, and they were supposed to get back to us in the next few weeks. So that hopefully will improve the revenue division.
When you say ICE, it's a cobweb in the back of my head here. Didn't we have some concern about taking ICE
Yeah, I mean, we have them for a short amount of time, and any concerns that the sheriff had regarding documentation, they've addressed. So whatever concerns there were in the past, they've fulfilled, and really haven't had any issues with them since.
Okay, thank you.
Are you satisfied with those concerns? You want me to explain?
If you've got more information.
So, in the past, ICE is, if a police department brings somebody in and they're on state charges, ICE is sent over a document, especially upon release, to hold the individual, called a detainer. And the detainer is not a probable cause statement. It's basically a request that they can do to request the sheriff hold somebody. Unfortunately, there's no probable cause tied to that. They usually do that to give them 48 hours to develop probable cause. And if, God forbid, they forget to tell us to release them, in essence, I'm holding somebody beyond their release, their legal release date. So we have worked it out where they give us the documentation that we need that will protect us so that we don't get sued for basically false imprisonment. So I'm confident the staff knows that we do not just take a detainer. It has to be a series or a series of reports.
So I would like to request formally, if we get to a point where we are holding people without uncleared state charges based on a detainer by any federal authority, that we will examine the question of whether adequate probable cause is established for us to hold them.
Yeah, we aren't holding them on detainer. If they don't have probable cause in this report, then we're not holding them. What we're doing is saying, look, we're releasing this guy because all the state charges have gone away. Either they've made bail, they've done their sentence or whatever, and we're releasing them at 9 o'clock. So you get here before 9, and you can re-arrest them and bring them through the door. But we will not hold that person beyond their release date without probable cause. So it's put the onus on ICE to actually come over, instead of making a phone call, to come over and grab the person and then bring them through the door under their authority. Because keep in mind, immigration law is unlike any other law, as you probably know. You know, they can lock people up for, civil cases, and we would never do that in the state.
They're responsible for claiming that they have the detention authority, and as long as it's on their authority, then we don't have any quarrel with that.
Yep, no, if they bring them in, I won't question them, just like I don't question the state police for their arrests or the Portland police for their arrests. It's just when they call over and say, don't release that guy, please, we want to do some, no, we're not doing that. So,
Okay, that's good.
all right?
Thank you. And we're pleased to have our council here tonight, and if you have any comments for the public, Alyssa?
I don't have any at this time, thank you.
Okay, and commissioners, Commissioner Jameson?
I know this will surprise you and everyone in the room. I have nothing further to add tonight.
Shocking. Commissioner Smith?
Following suit.
Well, Commissioner Watonis?
I have nothing to say.
What about Commissioner Gordon?
Well, I have a couple, two things. One, just a reminder, Clam Festival's the 19th through the 20th, so if you are so desired to go to a community that's going to have a phenomenal growth for that period of time, I think we go from something like almost 10,000 to up over 100,000 for those days. It's a great time. And then the other is, boy, I've been going around on some weekend travels, and the traffic on 302 is brutal. The traffic up Route 1 is brutal. So my advice to anybody that's listening is, if you're going to go someplace, please leave early and leave time for patience. Thank you.
I was going to mention the Clam Festival myself, especially I think probably my 30th attendance in a row to listen to the Wicked Good Band. They're not as young as they used to be, but still pretty funny. With that, I think we've finished our business for the public meeting, and I will request a motion to go into executive session for two items. One being a discussion of contracts associated with the cross insurance.